This is Dr. Alok Roy. Namaskar, this is Dr. Alok Roy. And like every week, again, this Saturday, we are here with a very important topic, knee pain and how to deal with it. As the life expectancy is increasing, so is knee pain and all kinds of joints pain. We have with us Dr. Vikash Kapoor. We'll talk about it. But before we start with him and hand over the mic to him, we must apologize for last week. We couldn't come up with our last week's session because all our doctors were very busy in a conference and just no one had any time to contribute to this webinar. Hence, we skipped it last week. I'll make sure that we don't do it again, but then such is life. So today with Dr. Vikash Kapoor, who's a very well-known joint surgeon, known as a knee surgeon in Eastern India. And he last month, he did 100 knees in a month. So he does a lot of knees very successfully. And so I requested him to talk about knee pain and how do we really deal with it? What needs to be done with the knee pain? When is the right time to operate? What precautions one should have so that he doesn't get or she doesn't get knee pain or should have less knee pain? And what are the treatment available? And with that, we hand over the mic, Dr. Vikash Kapoor. Vikash, over to you.
Yes, sir. Good evening and sorry for such a rushed because it was a Saturday and everybody wanted to show on a Saturday. So I was late in the hospital. Thank you for this opportunity and sharing the screen with Dr. Roy, who is the main force behind whatever we have been doing in this part of the world. So,
because you are not audible. You have to speak in the mic.
Sir, I am speaking through. Now am I audible? Hello? Is it better? Hello?
Yes, sir.
You are very clear now. You are very clear now.
Okay, thank you. So I hope I can. So basically, knee pain is because of several reasons, and as you can see here, these are traumatic, which is because of an injury, because of degenerative and aging, because of various inflammatory pathologies, because of birth defects, and because of infection, because of tumors, and because of various things like diabetes, thyroid, osteoporosis, which is a part of metabolic syndrome. And whenever we look at the knee, we should see what is the perception, what is our perception, have a good adequate history and associated problem. This is slightly on the medical side. And these are the ways we injure ourselves. And you can see how the sports is playing a huge role in getting knee injuries and knee pain. So as we live not only longer, but younger with a lot of injuries coming our way while we practice the sports with all enthusiasm and to attain happiness. Sometimes these are the consequences that we face. So we just examine the knee as a doctor, and there are lots of things which I need to sort of I could have talked about, but I would rather kind of take you through various different problems which are there, and these are the injury patterns which are identified, and these are the tests which are seen. So not really for the perspective of patient, but these are the tests with which we identify various types of injuries like ACL injury, which is the ligament of the knee, main ligament of the knee. And when it is torn, every time you feel as if you are twisting your knee while walking. So as you twist your knee, you tend to fall, and that is where people get various different types of injury. So it is very important early in age, even up to the age of 40, 45, when the activity of life is very high, people tend to play a lot of active sports to get this particular ligament sorted out. So this is the most important test. Every time you go to a doctor nowadays for a knee injury, the first investigation which you need is a MRI, because nowadays it is not all about fracture. Fracture will not let you walk, but ligament injuries will let you walk. So technically you are walking, you are feeling that you may be able to carry on your day-to-day activity, but you are degenerating your knee. Because after all, God made 4 ligaments in the knee. And if you injure one of the ligaments, 30 to 40% function of your knee is gone. Technically, your knee is behaving abnormally. So you will start having problems in the not only in the knee, which will start degenerating, degenerating faster, it will take a lot of stress. But also you will start having problem in your back, your neck, your foot, your ankle, because you will be actually loading those joints much more than when you are using a normal knee. So in order to prevent the abnormal knee from taking too much stress in the absence of a ligament, you tend to injure other parts of the body where you put a lot of more stress to walk in order to maintain your posture. So that is a very important part of the understanding, that when someone tells me, Doc, I can walk, I am okay, the ligament is torn, I have some problem, but actually he's walking with a lot of effort on all other parts of the body. So this is the slide of ACL reconstruction. We have done around 3 to 4 thousand of such reconstruction. I have personally done in this 20-year period, 22 years since I started doing arthroscopy. An arthroscopy is a surgery where you do a very minimally invasive, where you just puncture the knee, you put in a telescope, and then you can build a lot of things inside the knee. Now, this is a surgery which we have done from very famous footballers to gymnasts to hockey players, soccer stars, cricketers, etc. Besides that, even the housewives and day-to-day recreational sports people have taken this injury seriously, and nowadays the rate of doing arthroscopy in our hospital is going very, very high. And this particular arthroscopic surgery of knee, shoulder, ankle, elbow, hip, which is not done anywhere in the Eastern India but in our center. So these are all injuries which are coming up because of various things. Today we talk only of the knee. So ACL is like a fish plate between the two rail. If you remember how a railway track is, so if there is a fish plate in between, so what happens if you remove the fish plate? The various people who used to sabotage the railway, they used to remove the fish plate. So when the rail passes over it, the two what do you call railway lines, they ride over each other. That is exactly what happens if you remove the ACL from the knee. So the two bones, the upper bone, thigh bone, and the lower bone, tibia, they ride over each other. And technically, what happens is that a person falls. So our ACL is like a fish plate in between the two railway lines. Now, the other important ligament is the PCL, the posterior cruciate ligament. So, when a person falls like this, as you can see, somebody falls from a motorcycle or a scooter, this lower bone, the shin bone, goes back and it hits the ground and it goes back, and the thigh bone against the thigh bone, and this ligament is at the back of the knee and it gets torn. The biggest problem with this ligament is that it is not as important as ACL, but when you go down the stair or you go down the slope, you cannot go down. Your knee will buckle, it will be very painful. Otherwise, when you walk straight, there is no problem in PCL injuries. So, with the people who want to do skiing, who want to go down the hill, especially in the hilly areas, people who stay, people who want to go up and down the stairs the whole day, if this ligament is not there, you cannot walk. This patella bone, which in Bengali you call malai chaki, or हम लोग हिंदी में उसको patella ही बोल सकते हैं. So whatever we call it, that under surface gets eroded. So therefore, that is also a problem. So these are the tests for this thing. Again, as you can see here, this is the normal posterior cruciate ligament, and this is the torn ligament. The other two ligaments are the ligaments which control the knee sideways, the medial collateral, lateral collateral. This is going, and these are the tests for that. And once these are torn, these also knee opens up on inner side or outer side. Again, you have to repair. So a lot of understanding and a lot of new things have happened in our last 20 years of our practice. And these are two very important structures in the knee, which is called meniscus. Now, the meniscus is like a cushion. So when the body weight is going from the top through the thigh bone, you can see this is the shin bone's top. This is the roof of the shin bone. And that is covered by these two cushions. So if your thigh bone is putting weight on the shin bone, these two cushions are like washers. They take away all the stress and your shin bone remains protected. But if these washers are not there, they are cut, they are torn, then what will happen is that the whole weight will go from the top of the thigh bone directly on the shin bone, and it will start hurting. The cartilage will degenerate and arthritis will develop. So this also needs to be replaced. These are the mechanisms of injury. So usually it is trauma, rotational force, combination of forces, and it is usually, if you have old injuries, the knee will become very bad very quickly. These are the presentations you will call. We call sometimes you have catching of the knee, giving way or buckling of the knee. These are how people describe their problem. My joint is stiff. I can't walk. I have to limp. There is a pain on the inner side of my knee, which is the joint line pain. There is effusion in the knee. Effusion means swelling of the knee. People get worried. I did not do anything. All of a sudden, my knee swelled up. It can happen in two cases: an old injury which has been causing arthritis, or in a proper arthritis, which is called like what do you call a rheumatoid arthritis or an. Then clicking. Sometimes you feel clicking. It is harmless usually. It has no problem, but generally 2 out of 10 clicks are because of injuries, and that should be properly investigated. So there are so many things which people describe, which give us an idea of what is actually torn and what to test for. And the MRI is the examination which you must get it done, and it is the most important diagnostic tool for doing properly assessing a knee problem, meniscal injuries, etc. And this is the arthroscopy. I think it is beyond the scope of this discussion. These are the photographs inside the knee, which we see where we are able to do various kinds of surgery. This is an arthroscopic surgery. I think these videos don't seem to be playing. It's okay. So these are different types of syndrome. The anterior knee pain syndrome. This can be treated very well by physiotherapy. Then there is a patellar dislocation, where the kneecap sort of goes out of the knee. So people who dance, suddenly they fall because the kneecap gets dislocated. This is also a very important problem which a lot of children face, and they need to be treated. This is a harmless thing called Leica syndrome, which you call clicking in the knee with pain. Very thin structure becomes very tight, and it starts giving pain. Keeps snapping, clicking, or jumping off kneecap during knee bending. So these are the tests. Sometimes we get loose bodies inside the knee. Just like gallbladder stone, we get knee stone also. These are floating inside the knee. They are cause of severe pain. Your knee gets caught sometimes, and it can be simply removed by arthroscopy. You can just clean it up, and there is no problem. So now we come to the most important part of the discussion. What we see every day, what all of us are actually afraid of, which is the osteoarthritis of knee. আমার হাঁটু ব্যথা, হাঁটু খারাপ হয়ে গেছে, or bath, or what we call घुटने में गठिया की तकलीफ. So this is basically not a disease. It is coming with age. The older we grow, we are bound to get it. Nobody can cross 80 without having some osteoarthritis of knee. It is not possible. What you can have is a reasonably comfortably painful situation where you don't have to take painkillers. But everybody in this world who has crossed 80 will have some arthritis of knee. That is the degeneration. It is a gift of life. We should be happy that we don't have a painful knee at 80, but those knees will definitely be stiff. They will not be as supple as they have been in the past years. So that is a gift of life which we carry with us. So in a small humor, so when you get older, everything hurts. But what doesn't hurt doesn't work in the old age. So that is the truth. So that is the truth about arthritis. So this is again about degenerative meniscus. We have discussed that, and this is how it feels. 91% of the patients, they go ahead and happen. It causes knee arthritis. Arthroscopy in knee arthritis is only reliable for very small problems, because once the degeneration of the knee starts, you have to treat it either with physiotherapy, medication, injection, cleaning, or eventually with some intervention in the form of surgery. So these are the things which happen, giving way of the knee and various different types of problems. Sometimes this knee pain, as you can see, that there is a problem in the knee somewhere which is not identified in the X-ray, but this patient had a bone tumor, and that was the cause of knee pain. So it's a different, unusual cause of knee pain, We do see such cases. I've operated many of these bone tumors with various bone grafting techniques. Nowadays, people tend to call it a cancer. It's not actually a cancer. It's basically a simple cyst inside the bone, and once it is treated, it kind of gets healed. So basically, when you see somebody like this, you know what the problem is. But when you see somebody at this age doing this, actually, he also has an arthritic knee, but he is a brave man and he has maintained himself well and has been able to carry on with his life with good exercise. But this is not something which is usual. This is what is usual at the age of 85, 90 in most of the cases. Here you see a simple X-ray. Even people who are not doctors can appreciate that this bone is sitting on this bone. This bone is sitting on this bone. On the contrary, actually, this side you can see there is a gap. This is normal. Actually, the gap is normal. No gap is abnormal. Now, that is the beauty of the understanding the X-ray. People think they come to us and say, "Doctor साहब, घुटने में के X-ray में gap आ गया." Gap नहीं है, gap खत्म हो गया. That is what bad knee is all about. So when this gap is disappearing, that means it is bone on bone situation, and you will not get any relief with any medicine. This is the time when we intervene as surgeons. We should not let this happen, and before this happens, we should do something to save the knee as early as possible. So what are the options for degenerative joint disease or knee pain? The most important option is the weight loss. Any BMI more than 27 or 28, you will definitely have a pain in the knee. BMI between 20, less than 27, 26. I'm not saying ideal BMI is 25 nowadays. In my when I started my work, it was 26, but nowadays it is 25, and I'm sure with the way diabetologists are going and cardiologists are going, they'll make it 20 one day. But presently it holds 25, but I think 26, 26.5, 27. These BMIs are maintained BMI. They will not give you unnecessary knee pain. But anything above 27, 28, 29, when you get into real overweight category, when you get into real situation where you will have too much of stress on the knee, you will have pain. So what do? First thing, activity modification. Don't sit on the floor. Don't sit on the low surface. If you sit on a low surface, basically what is happening is when you get up, you put a lot of stress on the knee. Once you put a lot of stress on the knee, it is almost 5 to 6 times the body weight. So somebody who's weighing, say, 80 kgs will put almost 240 to 300 kg of weight on the knee. Think a knee which is already damaged, if it takes that kind of weight while getting up from the floor, it will be completely gone. So therefore, most important, if you have knee pain or any knee injury, sit on at least 18-inch height or 20-inch height. I have an anecdote to share. See, when we were initially in like 20 years back, we were building our own setup or a house, you could say. So these people in interior designing, they kind of say that, no, the bed will be 16 inches. That's how it is today in the fashion. I made him make a bed of 24 inches, 22 inches height, which included the cushion. And then he said, it is so high. I said, you are not going to sleep on it. My back and my knee are going to be affected by this. And therefore, it has stood the test of time. 20 years down the line, we still feel that we have done the right job. So please do not listen to people who are talking to you from the point of fashion. It is important to understand what is norm for somebody else may not be a norm for you. So I always recommend minimum 18 inches from the ground for a place to sit, and at least 18 to 20 inches from the ground, including when you go for your restroom. At least 18 inches should be up from the ground, because that gives least effort. 18 to 20 inches, you can easily get up. Actually, some of your knee pain will go away. Some of your back pain will be relieved if you sit on a high surface. That is very important. That is activity modification. Another thing we have talked about the stairs, etc. The cane. So if you have severe knee pain, the first thing you do is offload. How do you offload? You take a cane and walk. It is not shameful to take a cane. There was a time when Rai Bahadurs used to take a cane and walk. It used to be a status symbol also. We are now thinking that we grow old, so we will not carry a cane. You can avoid a surgery surgery while carrying a cane. If you want to carry a cane and you don't have pain, then you can avoid a surgery. It can be a catastrophic situation. So therefore, in case you are not wanting or medically not fit for surgery, or sometimes you don't have the proper health to go for surgery, you should use a cane and you should avoid a surgery in that situation. Physical therapy, you must always exercise. You see, but the exercise are of two types. Walking is an exercise for heart, but it is work for the knee. On the other hand, sitting and weight training with the knee or strength training of your knee without putting weight on the ground is actually exercise for the knee. It is not for the heart. So technically, if you are walking, you are using your knee. Walking is not an exercise for knee. Exercise for knee is more like yoga, more like strength training of the knee, more like using quadriceps table, etc. Then you can use brace or kneecaps, various types of kneecap to avoid surgery in order to offload the knee. You can use ice packs if the knee are very painful. Hot pad is not an option. Hot pad is not an option. Hot pad is an option when you have a chronic muscular issue. Cold pack is an option when you have an acute inflammatory issue. 90% of the people have severe pain, swelling, ice packs. Warm compress is an issue when you have stiffness. Pain is not a major factor. Stiffness is a major factor. So this is an important understanding which we must have. What are the options we have for treatment? Doctor साहब पेन किलर नहीं खाएंगे, दादा बेथारोशुब देवेंना. This is not the right way. Actually, these medications have a certain indication. They are not just painkillers; they are anti-inflammatories also. They control the inflammation without taking the steroid. They are non-steroidal anti-inflammatory drugs. So you take it for 15 days, 20 days, as your doctor gives. Trust your doctor. Forget about your Google. Google is not going to help you. Your neighbor is not going to help you. What is going to help you is your doctor. You've given your trust and money to the doctor. You must understand they will give you the best because they are accountable for what they are doing. Therefore, anti-inflammatories are the cornerstone of treatment. They don't harm you if taken in the proper way, proper dose, proper time. There are things like nutraceuticals, like collagen. Various types of collagens are being used. Various types of dietary molecules are being used. They do have some anti-inflammatory effect. Sometimes they are called to be placebos, but 50% of my patients, if not all, get some relief, but always with exercises. No medicine will work if you don't exercise. Exercise first, medicine has to follow. Only medicine, it will not work. Corticosteroid injections we give in cases of rheumatoid arthritis, in cases of pain of the knee, which is non-infective in nature, which cannot be operated. There you can give steroids in order to bring down the pain. That is a very good therapy for very old people who are not fit for operation. But for people who are younger, they should avoid these injections. Only footballers take it just to play over the season or the match, after which they get operated or treated properly. Then there is visco supplementation. This is basically giving lubricant injection in the knee. Giving lubricant makes the knee more supple and takes away the friction and removes the stiffness of the knee. So there are various types of analgesics, which I think we will not discuss here. Advantages are it is important in giving relief to the inflammation. Disadvantages are that repetitive, unnecessary taking may cause to sort of gastrointestinal problems. You may have peptic ulcer. You may have kidney problems, cardiac problems. But if you buy it yourself and take it, if you are afraid of surgery and you need a surgery and you want to suppress the surgery, you don't want your family members to know. A lot of people keep on taking these pills. They land up with a dialysis and with a bad knee. But you better have a knee. Knee is an artificial structure. You can buy it and get it replaced. But a kidney, you need a relative to give kidney to. Why do you need to do that? So therefore, you must be cautious while taking medicine yourself. Please don't take it yourself. Now, these like glucosamine, chondroitin, these are initially supposed to be like taking a lot of sugar, flour, eggs, etc., and making a cake in your stomach. These are the components with which the cartilage is formed. A lot of people say that there is some relief. A lot of people get no relief. But I feel exercise along with these natural medications sometimes are helpful. Although it has a very sort of iffy kind of this thing, but it doesn't harm. That's the most important. It is well tolerated, and they are superior to placebo. That means sugar pill, but and some of them are actually better than giving a pain pill. And these are slightly expensive medications. In our country, nothing is expensive when medicines are concerned. Nowadays, they are slightly more expensive. But if you compare to US or UK, these are much cheaper in our country. We are lucky that. And mechanism of action, although not clear, kind of works if you do the exercises. There are dosings and there is. Then there are injections, which I have discussed with you. Steroid injections. Please only take it when your doctor gives you, and trust your doctor. Take it if your doctor tells you, but not more than 2 or 3 injections in your 3-year period. If you take too many, your knee will go for a toss. So therefore, there are certain dubious people working in our industry who give a lot of injections in the knee. But unfortunately, I have myself taken a couple of them because I've had sports injuries. But technically, I think you should only take it when you're really kind of tiding over the crisis. You should not use injection to suppress your pain so that you don't get a surgery. I think that is the wrong way of looking at things. And that is where people get the side effects. So it gives pain relief, it decreases effusion, it's inexpensive. And of course, the problem can come back, etc., as you can see. Viscosupplementation, as I said, it is a synthetic product which can increase the lubrication in the knee, causes significant amount of knee pain and stiffness, becomes less, but can only be given in early arthritis. Cannot be given in bone-on-bone arthritis. So the good part is that there are lots of studies nowadays, and it has shown that some of it is working. I've been using this Sinvisc One for 22 years. I actually started. I was the first person here in Eastern India to use this because I had bought it from Singapore. It was 2022 years back, and then after that, it was launched in India, 2004 or 5, from when it was again started usage regularly. So there are various things historically which we have been doing as a hospital department. And these slides don't carry very many things actually which we have been doing in our department. That will be for some other day probably. So when to refer a patient, your friend or relative to me. Suppose this is your relative or friend, please don't refer her. She's got a better flexibility than I am. So obviously she doesn't need any knee consultation. But obviously somebody who has maximized the limits of non-operative treatment, like what do you call, taken injections, taken steroid shots, taken medication, done years of physiotherapy and exercises, still cannot walk. There is bone and bone. They are almost crying to walk to the toilet. These are the people who need help in the form of surgery. So what are the etiology of pain? You see the bent knee and the corrected knee. As you can see, the right side knee is a straight knee. Left side knee was actually what she had on the right side. So she had a lot of pain on the inner side of the knee, which got corrected with one simple surgery called high tibial osteotomy. This is a beautiful surgery done in young age. It can make you happy for 20 good years. After that, when you are from your 40s, you jump to your 60s, you can always, if your knee goes wrong, go for a joint replacement. This saves the natural knee by correcting the alignment. As you can see in this patient, where this knee which has been operated is straight, and this is a bent knee, which is the original knee of the patient. And it avoids or delays the knee replacement in young active individuals. After this, people can actually play sports, they can do all kinds of activities. These are various types of x-rays. These are the latest ways of doing. We do bone grafting. These are synthetic bone grafts which are used to correct the knee. These are all done recent, latest technologies, various different types of plates getting used. And we have a very large series of young active sports people who have taken this surgery. So when everything is ending and you are kind of situation where nothing works, then it comes to the knee replacement surgery for the knee pain. And thankfully, last the first knee replacement I did was in 1998. That year I only did 2. And then after that, time has come when in a year we do more than 1200 or 1000 joint replacements. So how has time changed? And it has changed because the person who got operated in 2000 is still carrying on with me for last 22 years. So what you did 20 years back, it's your karma which gets back to you. They bring back the good words, they bring back the people. So today we stand as a team in which has been working since Medica has started and previously also together. It's been almost 18 to 20 years of 15,000 knee surgeries in our past 20, 22 years of work. So with that kind of experience, I think we can claim or we can say that knee replacement is almost 90 to 95% does well in 20 years. This is an old slide. This was 10 years at that time. Today, in 20 years, survivorship is 88.6%. So that caused only 10 out of 100 people operated will not go on till 20 years. And I'm sure this will become 80% at 30 years. So therefore, and I don't know how a 60-year-old, if they get their knee replacement done, they will surely last up to 90, 75 to 80% of them. If they are alive, they will be okay. And if they keep exercising, I think this is the final surgery which they will need with some uh, limitations. So nowadays we do it with a 3-inch incision. We have a partial knee replacement also. We are doing almost 4 or 5 of partial knee replacement every month in our hospital now. You only need to replace the inner part of the knee. The other 2 parts of the knee are your own, and this is a much better knee. You can start walking normally in 5 to 6 days. You can actually go back to work in 15 days after the sutures have dried up, and you can start driving a car within a month's time, which is a wonderful thing to happen in such cases. And these knees last for 10 to 15 years, after which, even if they go bad, you can actually do a knee replacement which will last another 30 years. So technically, we are looking at options for younger patients now. We are looking at options where young patients who have very bad knees, who are wheelchair bound because of arthritis at the age of 45, they should be able to get relief and become economically more reliable. They can earn for themselves and their family. They can actually change the life of their whole family by going out to earn. They are not a burden on anybody. There is a lot of self respect involved in treating knee pain. Actually, treating knee pain can prevent a heart attack. The knee pain is so severe that the endorphins which get released, the kind of hormones which get released can cause vasoconstriction, tachycardia. So the tachycardia which happens because of reaction to pain, if the heart is weak, one can get a heart attack. There are people who have reported better blood pressure management, better cardiac improvement after just getting a proper knee replacement done. The knee pain, once it goes away, it can be a boom. It can increase longevity, not of the knee, but of the person who has got it done. So who does the joint replacement? Experience counts. You have people who do 20 knees a year. You have people who do 1,000 knees a year. It is up to you to decide and how it goes about it. A general orthopedic surgeon can do it. Of course, they may do something which can become lasting 25, 30 years also. And therefore, all the surgeons, actually, we have a very big program of training orthopedic surgeons, arthroplasty, FNP, where people qualify a countrywide exam. And we are the only center in Eastern India now who is training 2 people after their post graduation for 2 years who come through an exam all India in joint replacement surgery. And we are one of the 13 centers in the country which are actually recognized for it, which is a great going for a medical hospital. So the summary, there are numerous non-operative things to do. There are avenues for research. There are good surgical options, and high level of function is usually there. So we don't need to get disheartened. The future which I am working on is cartilage regeneration and implantation. It needs investment. It needs a lot of effort. We will do it, and this is the we do a lot of research in our program and thesis and all these things. The doctors are working on it. We are publishing papers, and we are trying to make sure that this team of orthopedic surgeons which works together is able to tomorrow bring about the best of technology in regenerating cartilage. So tomorrow, after 20, 30 years, we want knee replacement to be over forever. We want to start something which can give biology, stem cell, etc. to get the knee function back. Let's see how it works. Uh, Thank you. I think I would stop sharing the screen.
Okay, thank you, Vikash.
Sir,
So you all,
yeah. Yeah.
yeah, you have taken it off. Good. So you all will agree that Vikas has done a great job of explaining what knee pain is and what are the best ways of tackling it. Because a few questions which are coming to my mind first. That of course, in youngsters who have a trauma and who lead a very active life, when something goes wrong, they are the one who need to get it addressed through by whatever arthroscopy or whatever is required, ACL, PCL repair, ligament repair, to for them to continue living life and going back to their very active life. But what are this osteoarthritic changes which you said, which is like arthritis, which is like a joint when it loses space becomes painful? At what age it really appears in your practice? What age of people come to you with the degenerative joint disease as you describe it?
Sir, if you call completely degenerative, it can happen. It usually starts in 40s, in mid 40s. It will not start before that. It will not start if it is a part of a trauma problem, a neglected trauma like a meniscal tear, somebody has not got it treated. Somebody has a bent leg and they've been walking since childhood on a knee which is bent inwards a lot. They have been putting pressure on the inner side of the knee and they start getting degeneration faster in 40s. But I think 40, 45 is a watershed line. If you start getting knee pain at that time, you should get it treated immediately because that then there is a cause which you can actually address. After if you tolerate a knee pain and you don't get it treated properly, if you have a cause which is not corrected, by 55 that knee will go. So my experience is a decade between 45 to 55 is a very important decade from the point of view of longevity of a person. That is the time which decides how long actually a person is going to live. Anybody who has a bad knee is not going to live very far because they are not walking during that active time. They are avoiding. They are running away from the problem rather than addressing a problem. And sometimes people, they only think cardiac problem or a neuro problem or a kidney problem is a problem because that affects the life and the survival. But knee problem or a spine problem which causes you to go down in a day-to-day activity level will automatically start affecting other parts of your body, including internal organs, and those changes become irreversible if you delay your knee issue. So I think 45 is a time when you should be really aware of your weight, of your knee pain if it happens. If you don't have a knee pain, perfect. You have a very good thing going for you. And if you cross 50s without much knee issues, I think you really got a long way to go. Right.
So डॉक्टर
there is a lot
विकास
of
कपूर
philosophy.
कह रहे हैं कि अगर आपको नी पेन जो है 45 या 50 की एज में होता है, कोई जरूरी नहीं कि आप ऑपरेशन कराएं. बहुत से और तरीके हैं नी पेन को कम करने के लिए. अगर आप अपने मसल्स को स्ट्रांग करेंगे या जो कह रहे थे कि जो लेग रेजिंग एक्सरसाइज विद वेट, जिसके करने से जो है नी के आसपास के जॉइंट को सपोर्ट मिलेगा और आपका दर्द कम होगा. थोड़ी बहुत दवा, थोड़ी बहुत सलाह या किसी और तरीके से अगर आप अपने को हेल्दी रखेंगे, पेन से बच के रहेंगे, तो आपका नी ज्यादा दिन चलेगा और आपकी जिंदगी भी ज्यादा दिन चलेगी. Am I right, विकास?
बिल्कुल सर. इसमें सबसे अच्छी बात है ना कि जैसे कि अब हम लोग अगर इसको हिंदी में कहते हैं ना चुकी मुक्की बैठना, जमीन पे जैसे कि दोनों घुटने मोड़ के पहले इंडियन टॉयलेट में बैठा करते थे लोग, अब आज की तारीख में आप बच्चों को ऐसे बैठने बोल दीजिए तो नहीं बैठ सकते. तो इतनी फ्लेक्सिबिलिटी की कमी आती जा रही है हमारे सिस्टम में. तो योग एक ऐसा माध्यम है कि अगर हम लोग योगा अभ्यास करते हैं या अगर हम लोग योगा प्रैक्टिस करते हैं तो मेरी समझ से घुटने की और कमर की समस्या बहुत कम हो जाएगी. तो एक फ्लेक्सिबिलिटी की बहुत प्रॉब्लम आती है सोसाइटी में. तो अगर हम लोग 45 से 55 के बीच में अगर हमने एक्सरसाइज नहीं भी किया पहले, तो एकदम से कूद के दौड़ना ना शुरू करें. हमें पहले फ्लेक्सिबिलिटी करनी होगी, पहले अपनी मांसपेशियों में ताकत लानी होगी और वो मांसपेशियां हमारे नी को ऑफलोड कर देती हैं बेसिकली. तो वी शुड ट्राई टू डू दिस एक्सरसाइज. जैसे आपने कहा है कि वेट बांध करके घुटने को सीधा करना, मोड़ना या मसल स्ट्रेंथनिंग एक्सरसाइज करना, तो ये एक बहुत इंपॉर्टेंट मैसेज है जो आप बता रहे हैं, ये नी स्ट्रेंथ बढ़ाने के लिए।
तो डॉक्टर विकास, मेल और फीमेल में ज्यादातर किसको नी की तकलीफ ज्यादा होती है आपकी प्रैक्टिस में?
85% महिलाओं का ऑपरेशन होता है घुटना जब बदला जाता
Really?
है। और यस, मेरे अब ये मैंने पब्लिश भी किया है, और ये इस समय इनफैक्ट शायद नेशनल ट्रूथ है इस देश में। हमारे देश में सबसे बड़ा प्रॉब्लम ये है सर, एक बहुत बड़ा एक सोशल प्रॉब्लम है, जिससे सोशल इशू। कैटेगोरिकली लेडीज 50 के आसपास सबके अंदर हार्मोनल चेंजेस होते हैं, काफी काफी ज्यादा चेंजेस होते हैं। उस समय उनके सारे चेंजेस में उनकी हड्डियों पे सबसे ज्यादा असर होता है। हड्डियों पे जब असर होता है, हड्डियां कमजोर होती हैं, तो हड्डी में जैसे फीमर और टिबिया, दो थाई की और जो शिन बोन है, दोनों का जो वेट बेयरिंग पार्ट है, उसमें जो ऑस्टियोपोरोसिस होता है, तो जरा सा भी उस समय आपने जोर से झटके से बैठ गए, उठ गए, तो अंदर माइक्रो फ्रैक्चर्स होते हैं, ब्लीडिंग होती है, उससे घुटने में बहुत दर्द होता है। और उनका कार्टिलेज बड़ी, और वो होता है जो कार्टिलेज को सपोर्ट करता है, वो हड्डी कार्टिलेज को सपोर्ट करती है। तो जब कार्टिलेज का सपोर्ट सिस्टम पीछे से ढीला हो गया ऑस्टियोपोरोसिस में, तो कार्टिलेज टूटने लगता है। जैसे कहते हैं कि इट बिकम्स फ्रेजाइल, इट स्टार्ट्स डिसइंटीग्रेटिंग, कोलाजन डिसइंटीग्रेट करता है। अब आजकल देखिए ना, स्किन के ट्रीटमेंट के लिए लोग कितना कोलाजन लेते हैं, जगह जगह कोलाजन लगवाते हैं। उसी तरह से उस इलास्टिसिटी को घुटने में भी कोलाजन मेंटेन करता है। तो उसका जो सपोर्ट है, जब हड्डी की मजबूती के रूप में खत्म हो जाता है, ऑस्टियोपोरोसिस होने लगता है, तो महिलाओं में ये बड़ी विचित्र समस्या है कि बहुत ज्यादा ये प्रॉब्लम आ रही है। और दूसरी बात, हमारे देश में भी, इन आवर कंट्री, वी मस्ट से दैट लेडीज लुक आफ्टर मेल मच मोर। एक सोशल इशू है, वो खुद वो सारे इलाज नहीं करती जो कि एक आदमी कर लेता है, हेल्थ केयर तक पहुंचती नहीं है। उनके लिए हेल्थ केयर तक जाना, आज आप देख लीजिए कार्डियक इशू कितना ज्यादा लेडीज में होता जा रहा है। क्यों? क्योंकि वो चेकअप ही नहीं कराती हैं। आज हम लोग जब चेकअप नहीं कराएंगे तो हमारा रोग पकड़ा नहीं जाएगा, और वो सप्रेस कर देती हैं रोगों को कि अरे हमें तकलीफ नहीं है, हमारा काम चल रहा है। तो इससे क्या होता है, बाय द टाइम दे प्रेजेंट टू अस एट द एज ऑफ 60 और 58 ऑल्सो, घुटने बिल्कुल खराब हो जाते हैं। जबकि लड़कों को जरा सी चोट लगती है, जरा सी तकलीफ होती है, दौड़े दौड़े आ जाते हैं, इलाज करा लेते हैं। तो एक बहुत बड़ा, मैं इसमें एक सोशल एंगल देख रहा हूँ। आई थिंक हम लोगों को एज अ टीम वी शुड मेक अ बिग अवेयरनेस प्रोग्राम, दैट वी शुड मेक श्योर दैट वी हैव as much checkup as possible for ladies. We should give them that opportunity to come out and get tested, or should go and test for osteoporosis and for pain. You know, it will help the society at large and keep families also running well.
I think you are so right, Vikas. When I travel through airport, I hardly find ladies above 60, 65 who are walking normally. Very few. You can count them on fingers. If you see 10 ladies and watch them, most of them are not able to walk. They are waddling. So I used to always wonder that they are probably obese. Now, what you have said made a lot more sense to me, that it is not really the weight. It is the pain which makes them walk, and the bent of knee probably, which has destroyed their gait. Most of them above 60 are not able to walk straight like we see in the West. The Western country, the women walk very straight, and because they have been
सर वहाँ बराबरी है ना। वहाँ ये नहीं है कि तुम पहले खाना खा लो, हम बाद में खा लो। वहाँ ये नहीं है कि सर हिस्टोरिकली हम लोग जिस लेवल से सोच रहे हैं हमारे यहाँ सब कुछ बराबर है, वी हैव सेम रिस्पेक्ट है, बट 95% ऑफ दिस कंट्री, इवन हु आर वेरी वेल ऑफ, actually have a very different value pattern. I think this is a big social issue which we are addressing through knee pain here. I think, but this is a very important part of the discussion, I feel, which needs to happen in this platform also.
Absolutely. I think that's very important issue. We'll handle it some other time. I think I will have a webinar just based on that. Social issues which lead to the various health disorders for my audiences. One thing I want to know from you, that what are those injections which people give, hyaluronase and all those injections which people give, steroid in their knees. So what is the outer limit and how relevant are they?
So the steroids, as I said, that is an acute phase issue. Rheumatoid arthritis, people who cannot get a surgery done, very old and fragile people, they need pain relief. or people who have had recent injuries have to go and play in the ground, have to go and play a national level football match. They need those injections to overcome pain and play. But these injections will suppress the pain and inflammation, the steroids, but they will also cause harm to the knee because you are actually playing on a suppressed pain. You are not addressing the cause of pain. So be careful. For rheumatoid arthritis, it is a treatment. For injury, it is suppression. So we need to treat injuries eventually to save the knee. For rheumatoid, we need to change the module from steroid injection in acute phase to give anti-inflammatory medication, DMRDs, for treatment. That is one. Hyaluronic acid is a supplement which is visco supplement. These are they are helpful if given in the right indication. Problem is that some people are using it as a lure to the patients who are running away from surgery. So it is very easy to sell an injection to somebody, say that, acha acha apna ke operation korte hobe na, you take an injection. They keep on taking those injections. You must have seen the ads in newspaper saying that we treat without operation. They say that we treat without operation. This is what they are doing. They are actually using a good product in a wrong way. We should not do that. These injections are very helpful in patients for 2 or 3 years, and they are for early arthritis, which are not inflammatory, which are osteoarthritis. But they will run out of their life in 2-3 years' time, and eventually you will need some intervention.
Okay, thank you, Vikas. We are almost at the end of our timing. Last question.
I know.
The surgery, as you said, that's very reliable, and 20-year it lasts, could last 30 years, depending on the new implants which are coming. Now, it's very expensive treatment. What do you find that how patient responds to the cost of it? How are they concerned with the cost of it?
People in this country should thank their lucky stars that they were born here. This country is a boon for healthcare in knee replacement, hip replacement, shoulder surgery, and orthopedics. Same knee replacement in US will cost at least 25 to 30 lakh rupees. In India, it is costing, starting from the lowest is 1.5 lakh to 2.5 lakh rupees. If people are very rich, they want to stay in special privileged things in their own system, they can cost up to 3-4 lakh rupees. Even the richest of the rich will not pay 1/10 of the cost of US. We are extremely lucky society. The skill set of the surgeons in this country is 10 times the skill set of the surgeon in US. Any surgeon, I can tell you that. Doing 15,000, 10,000 knees is not a joke. It takes a lifetime to do those kind of surgeries. Today, the connect and the skill takes up, and plus the technology. Everything is available. Yesterday it is launched in US and today it is available in this country. In fact, the companies want to sell it here more than they want to sell it in US. So that is gone. I think what is important is if we do a comparative, if we call replacement like a transplant, it is the cheapest transplant available compared to liver transplant or kidney transplant or whatever transplant you do. So technically you are doing a transplant of the knee at the lowest possible cost. I think it is very, very reasonable price in India at this point.
Thank you, Vikas. I think you all will agree that Vikas done a great job of explaining that what needs to be done in case of knee pain. पैर के घुटने के दर्द से कैसे बचें और उनके इलाज क्या क्या संभव इलाज हैं। इसी के साथ चलिए हम थैंक्स देते हैं रोटरी क्लब ऑफ कलकत्ता अवियाना for supporting us in Bengal Chamber of Commerce and Industries. To all my listeners who every week on Saturday join us, and you all, your inputs into our webinar are very important. Please suggest what you want to know more from us. Please wait for next Saturday. Again, we'll join you on next Saturday at 5:30 with the new topic. Thank you, Vikas. Thanks for explaining. Thanks to everybody. Have a nice weekend. Thank you.